I think there are very few families untouched by issues like depression, anxiety, alcohol, substance use, eating disorders, suicide. And the numbers are pretty shocking. Pre-pandemic, I would have said 1 in 5 children suffer from a mental health condition that is impairing their ability to really engage in what you would want kids or teenagers or young people to be engaging in school and friendships and activities and their pursuits that they enjoy, their families and communities. Now, and Jason and I share colleagues and collaboration teams in Durango. Pediatricians there say 4 out of 5 of their visits are around a primary mental health concern at crisis levels. And less than a quarter of all children who are suffering from these common mental health conditions receive any sort of care or support whatsoever.
In 2015 through 2017, El Paso County was in real severe crisis with teen suicide. We had a school district that was impacted by several deaths within a span of a few weeks. And if you live in this area, you know what I'm referring to. It hit us like a tsunami. And so we asked the question, like, what is going on? And what do our young people need? And so we thought, well, we should probably ask them. And so we did the teen think tank surveys in 2017, where we went around and we interviewed a ton of different students and said, what is going on? What's working for you? What do you wish you had? And in 2017, we learned there are not enough trusted adults. And they were talking about a need for that. And we thought, yep, that makes sense, okay.
We provide school-based mental and behavioral health support with contracted therapists that working very closely with school teams to identify these youth through a pretty intensive referral process. But in order to provide that level of support where they're at, we're in a rural community and we have many barriers to access transportation under non-insured individuals. And so to be able to provide that at no cost to youth and families is a huge success for programming. We reached 242 youth through individual and group processes just last year. And around the group processes, you mentioned, we talked a lot about culture earlier. And so identifying youth that do self-identify LGBTQ+ or BIPOC and having specialized groups led by people that look like them and have a similar lived experience is a big success for us in the school-based programming. Recently, we also launched a school-based therapeutic mentoring program to one of our more rural schools in the county where otherwise they don't have access to much of anything. And to be able to provide this to elementary schools, again, talking about this level of connection, this level of supportive, trusted adults that they may not otherwise have, kids that originate from trauma from birth through the age to, a lot of them are elementary, so to the age of 10, has been instrumentally impactful for these young individuals. But we need to meet them where they're at. And we need to alleviate the barriers to basic needs in order to learn, in order to grow, in order to develop, and to become members of the community.
We actually have a planning grant this year from Caring for Colorado Foundation to use $50,000 to bring in stakeholders around our community, and now I have 4 new people to reach out to to bring them onto and ask them very specific in areas to how we can strengthen for our local community by using the partners and building things outside of the school that could also then be carried over to school. So having some resources to be able to ask the questions of what students need and what they want, and then figuring out what the parents have and what they need help with, to then be able to figure out who do we connect them with.
About 4 years ago, we went through a strategic planning initiative, very intensive. Bruce LeClaire was there from Ignacio to really understand the needs of young people. And what emanated from that conversation was the development of the Hub Therapeutic Program, an innovative education model made up of youth-serving organizations, school districts, Children's Hospital Colorado was part of that, Department of Human Services, all through a centralized co-located model in order to meet the needs of youth and families where they're at. We created a culture of belonging where students who are 2 to 3 years academically behind show up every day.
What I can say is that Kids need all different kinds of care from all different kinds of people. And so let's encourage organizations to get creative and to involve young people in their program development and decision-making process. Because if you ask me what someone needs, and then you ask that person that we're talking about, you could hear two very different answers. And that's true with our young people as well.